Today, we will be continuing our 2-video series on Alzheimer's disease. We will be continuing on how Alzheimer's disease is diagnosed.
Diagnosis. Most people go to their GP to get dementia diagnosed if they start realizing that they are developing memory problems. However, memory problems are not just caused by dementia, they can also be caused by 1. Depression or anxiety, 2. Stress, 3. Medicines, 4. Alcohol, drugs, and finally other health problems such as hormonal disturbances or nutritional deficiencies. Your GP can carry out some simple checks to try to find out what the cause of your memory problems may be. They also check other aspects of your health and carry out a physical examination. They may also organize some blood tests and ask about any medicines you're taking to rule out other possible causes of your symptoms. You will usually be asked some questions and to carry out some memory, thinking, and pen and paper tasks to check how different areas of your brain are functioning. If your GP is still unsure about whether you have Alzheimer's disease, they may refer you to a specialist, such as a psychiatrist, usually called an old age psychiatrist, an elderly care physician, sometimes called a geriatrician, or a neurologist, an expert in treating conditions that affect the brain and nervous system. The specialist may be based in a memory clinic alongside other professionals who are experts in diagnosing, caring for, and advising people with dementia and their families. However, there is no simple and reliable test for diagnosing Alzheimer's disease. At the specialist center, to assess your memory and other areas of mental ability, and if necessary, arrange more tests to rule out other conditions.
The type of tests. The first test is the mental ability test. A specialist will usually assess your mental abilities, such as memory or thinking, using tests known as cognitive assessments. Most cognitive assessments involve a series of pen and paper tests and questions, each of which carries a score. These tests assess a number of different mental abilities, including short and long-term memory, concentration and attention span, language and communication skills, awareness of time and place, also known as orientation, and finally, abilities related to vision, also known as visuospatial abilities. Other tests. To rule out other possible causes of your symptoms and to look for possible signs of damage caused by Alzheimer's disease, your specialist may recommend having a brain scan. This could be a CT scan, which are several rays of your brain being taken at slightly different angles and a computer putting the images together, or an MRI scan, which is when a strong magnetic field and radio waves are used to produce detailed images of your brain. Some specialist centers offer scans that look at brain function and particularly protein deposits, but these are usually restricted for use in clinical trials. In rare special circumstances, it may be recommended that fluid from your spinal canal is taken to analyze for proteins related to dementia, known as lumbar puncture. But this is not used routinely as a test for dementia and is more commonly used for research purposes.
Treatments. There's currently no cure for Alzheimer's disease, but there's medication available that can temporarily reduce the symptoms. Support is also available to help someone with the condition and their family cope with everyday life. Medicines. A number of medicines may be prescribed for Alzheimer's disease to help temporarily improve some symptoms. The main medicines are acetylcholinesterase inhibitors, also known as ACHE inhibitors. These medicines increase levels of acetylcholine, a substance in the brain that helps nerve cells communicate with each other. They can currently only be prescribed by specialists, such as psychiatrists or neurologists. Donepezil, galantamine, and rivastigmine are the ACHE inhibitors that can be prescribed for people with early to mid-stage Alzheimer's disease. However, the latest guidelines recommend that these medicines should be consumed in the later, severe stages of the disease. There's no difference in how well each of the three different ACHE inhibitors work. Although some people respond better to a certain type or have fewer side effects, which can include nausea, vomiting, and loss of appetite. Fortunately, the side effects usually get better after 2 weeks of taking the medication. Memantine. This medicine works by blocking the effects of an excessive amount of chemical in the brain called glutamate. Memantine is used for moderate or severe Alzheimer's disease. It's suitable for those who cannot take or are unable to tolerate ACH inhibitors. It is also suitable for people with severe Alzheimer's disease who are already taken an ACH inhibitor. However, side effects can include headaches, dizziness, and constipation, but these are usually only temporary. Medicines to treat challenging behavior. In the latter stages of dementia, a significant number of people will develop what is known as behavioral and psychological symptoms of dementia. An acronym is BPSD. The symptoms of BPSD can include increased agitation, anxiety, wandering, aggression, delusions, and hallucination. These changes in behavior can be very distressing for both the person with Alzheimer's disease and their carer. If coping strategies do not work, a consultant psychiatrist can prescribe risperidone, haloperidol, antipsychotic medicines for those showing persistent aggression or extreme distress. These are the only medicines licensed for people with moderate to severe Alzheimer's disease where there is a risk of harm to themselves or others. Risperidone should be used at the lowest dose and for the shortest time possible as it has serious side effects. Haloperidol should only be used if other treatments have not helped. Treatments that involve therapies and activities. Medicines for Alzheimer's disease symptoms are only one part of the care for the person with dementia. Other treatments include activities and support for the carer as well as the one suffering from Alzheimer's disease too. These are important in helping people live well with dementia. Cognitive stimulation therapy. Cognitive stimulation therapy, CST, involves taking part in group activities and exercises designed to improve memory and problem-solving skills. Cognitive rehabilitation. This technique involves working with a trained professional, such as an occupational therapist and a relative or friend to achieve a personal goal, such as learning to use a mobile phone or other everyday tasks. Cognitive rehabilitation works by getting you to use the parts of your brain that are working. Reminiscence and life story work. Reminiscence work involves talking about things and events from your past. It usually involves using props such as photos, favorite possessions, or music. Life story work involves a compilation of photos, notes, and keepsakes from your childhood to the present day. It can either be a physical book or a digital version. These approaches are sometimes combined. Evidence shows that these can improve mood and well-being.
Prevention. As the exact cause of Alzheimer's disease is still unknown, there's still no certain way to prevent the condition. But a healthy lifestyle can help reduce your risk. Reducing your risk of cardiovascular disease. Cardiovascular disease has been linked with an increased risk of Alzheimer's disease and vascular dementia. You may be able to reduce your risk of developing these conditions, as well as other serious problems such as strokes and heart attacks, by taking steps to improve your cardiovascular health. These include stopping smoking, keeping alcohol to a minimum, eating a healthy, balanced diet, including at least 5 portions of fruit and vegetable every day, exercising for at least 150 minutes every week by doing moderate intensity aerobic activity, such as cycling or fast walking, or as much as you're able to, making sure your blood pressure is making sure your blood pressure is checked and controlled through regular health tests. If you have diabetes, make sure you keep the diet and take your medication. Other risk factors for dementia. The latest research suggests that other factors are also important, although this does not mean that these factors are directly responsible for causing dementia. These include hearing loss, untreated depression, although this can also be a symptom of dementia, loneliness or social isolation, a sedentary lifestyle. The research concluded that by modifying all the risk factors we're able to change, our risk of dementia could be significantly reduced. Staying mentally and socially active. There's also some evidence to suggest that the rates of dementia are lower in people who remain mentally and socially active throughout their lives. It may be possible to reduce your risk of Alzheimer's disease and other types of dementia by reading, learning foreign languages, playing musical instruments, volunteering in your local community, taking part in group sports such as bowling, trying new activities or hobbies, maintaining an active social life, interventions such as brain training. Computer games have been shown to improve cognition over a short period, but research has not yet demonstrated whether this can help prevent dementia.
Thank you for watching. This video, our aim was to spread awareness of dementia. Some of my members are dementia friends, and so we felt that it was important to spread awareness of dementia further, which resulted in this longer than usual two-part video. We will also regularly be posting again from today. Make sure to like, comment and subscribe for more videos in the future. Make sure to follow us on our socials and check out our blog down below. Again, thank you for watching.